basically, I think of these ADCs as almost like a smart bomb. So basically, it's an antibody, and tagged to the antibody is a linker, and that linker is linked to chemotherapy. So on one antibody, sometimes you can have 8 different chemotherapy molecules. For example, sacituzumab has about an 8-to-1 ratio. So 8 chemos to one antibody. So you're able to deliver a ton of chemotherapy into a cancer cell. So in this case, the antibody is going to target a receptor that's on the cancer cell much more than that receptor is on normal cells, right? So it should be a receptor that is more specific to the cancer cell. So we know, for example, in triple negative breast cancers, more than 95% of tumors will have a TROP2 receptor on them. So that makes it a really good target because that's not commonly expressed on normal cells, but is almost always expressed on a triple negative breast cancer cell. So makes it a nice thing for that antibody to target. That antibody binds to the receptor on the cancer cell. It gets taken into the cancer cell and then releases all its chemotherapy into the cancer cell. So you're delivering a ton of chemo in a targeted way into the cancer cell. And so, again, I think people think of them as smart bombs because they're able to really target where the chemo needs to go and deliver a ton of chemo into it to kill the cancer cell more effectively. This is different than chemo, where you're just, giving a drug that kills cancer cells into the bloodstream. So it's not targetedly delivered into the cancer cell, right?